Joining us right now is Health and Human Services Secretary Tom Price. Mr. Secretary, thank you for joining us today.
Hey, Becky, good to be with you all. Thank you so much.
So let's talk about this newest health care plan. We know it's not going to be brought in the next day or two, that the votes aren't there yet, but you know this vote, you know the bill very well, and you know the House very well. Do you think the votes will be there soon for this particular piece of legislation?
Yeah, I think they will, Becky, and I think they will because what folks in the House and the Senate and across this land appreciate is that in the individual and small group market, that market that was targeted by much of the ACA, it's not working. You got a third of the counties in this nation where there's only one issuer providing health coverage. You've got 5 states where there's only one. You've got some counties where soon they will have no insurance company offering coverage on the individual and small group market. So it's not working. So what we've got to do is make it so it does work. And that's the secret that I think will bring this bill across the finish line.
Trying to figure out how to make something work, the opinions range. Probably every person you ask has a slightly different opinion on how to make this work, which is where you run into the trouble with trying to bring legislation that brings all those parties together. If you get a piece of legislation that can pass the House because it brings the Freedom Caucus in, do you risk having a bill that the Senate is not going to want anything near what that bill is going to look like? I guess how do you
Sure.
combine all of those different voices on the Hill and try and come up with something that is something you can actually get passed from both houses?
Well, it's a balancing act. There's no doubt about it. But at the same time, again, what people appreciate is that the current system is failing. It's not working. You look at the Medicaid system that is so important for the vulnerable population in our nation, and you've got more and more individuals, more doctors, more providers bailing out because they can't practice it within that system. So this is a system that's not working for patients, and that's what we need to concentrate on. We can concentrate on government, we can concentrate on insurers, yes, but the important thing is to concentrate and focus on patients. And if we keep our focus and our eyes on the patients, we'll get to the right answer. And that's what I think that Congress will do over this period of time.
Secretary, you bring a lot of different hats to this. Not only are you a former congressman, you're also a doctor by training, and you understand how things work. I know the doctors that I talk to say that part of the problem is, look, it's really complicated to try and keep up with all of these things, and that they can't be spending as much time with their patients because they're trying to figure out the computer IT part,
right.
They're trying to figure out regulations, trying to go around, which is probably why you see so many small doctors' offices combining, because they just can't go it alone anymore. However, we need those doctors to be using some of that computer technology to make sure that we are streamlining the process and finding ways to bring down healthcare costs. So how do you combine those two realities?
Oh, it's a great question. I actually spoke to a group yesterday that were organizing or gathering here in Washington, D.C. for what they called the Health Datapalooza. And it was a group of over 1,000 individuals who are working in just this space, trying to make certain that we're using health data, health information technology in the wisest way. You know, and I know, and the folks who are watching know, when they go to their doctor's office, oftentimes they're still in the 20th century or even before. They're still working with paper and pencil, as opposed to the kind of remarkable technology that now exists out there. You think about the apps that are available for folks to be able to know in real time what much of their health status is. We need to harness that information and harness that enthusiasm and move in a direction that actually empowers the patients to be able to engage in this system in a way that improves their health status. And that's one of the things that the president is so desirous of, is making certain that we do, in fact, move in the direction where we're using health information technology and technology itself to be able to empower patients.
Mr. Secretary, like so many things in life, it's a little bit crazy. So people start to see the possibility that Obamacare gets taken away, and suddenly the approval, which was never above 42, it goes up to a majority, and it's like 52. At the same time, that's emboldened Democrats to suddenly put forth the narrative that it's not failing, and that there are organizations saying that it is viable. So at this point, when you take that away, an entitlement, or change it, there's going to be people that may lose insurance. At the same time, maybe you reinstitute freedom of choice. Maybe you put it back in the patient's hands. You might do all these great things, you know, on the big picture that are the right things to do, but you're not going to get any coverage on that from certain members of the media. All you're going to get is those people that lost insurance. And there's going to be a political price to pay for this. I mean, yep. Why do this? I don't. There is going to be, you may lose the House. The Republicans might lose the House. Who knows what happens when you do this? Very cleverly done by Democrats, I might add, because you're in a pickle right now. I don't know how you maneuver through this.
Well, I'll tell you who's in the pickle, and that's the 20 million individuals out there who've said, no, don't put me in that system. The people that are in the pickle are the ones that have the health insurance card right now, but they can't afford the care because their premium's so high or the deductible so high. The reason this is going to work is because what the president has outlined and what we believe so strongly is that nobody ought to fall through the cracks. We want a seamless system between Medicaid, between the employer market, between the individual and small group market, and Medicare. And the imperative is to make certain that we have that seamless system so that we don't pull the rug out from under anybody. The current system is failing those in the individual and small group market. It's failing so many of those in the Medicaid market, and it is failing the folks who are actually trying to provide the care out there in so many ways. So change is difficult. I understand and appreciate that, and it's hard oftentimes to harness the critical mass that it takes to bring a bill across the finish line in Congress.
Says,
Mr. Secretary, the CBO and others have suggested that it may not be failing in the way that it has been described.
Yeah, but the CBO actually said that right now, 4 years ago, right now, you'd have twice as many individuals covered. The fact of the matter is that the Congressional Budget Office isn't looking at the entire package because that's not what they're charged to do. They're charged to look at very specific small pieces of legislation that are not the entire health reform. And that's why you get this partial information. And that oftentimes spooks individuals and makes it so they're not on the Hill, that they're not necessarily supportive of this piece of legislation. But the fact of the matter is, as a package, this is a huge improvement over the current system.
Let's talk about the latest tweaks that have been added, because the initial rub on this, and again, this is legislation that I know is still in the process of changing, but the initial rub on that new legislation that brought some of the Freedom Caucus members along to agree to vote for it suggested that people with pre-existing conditions would be paying much more in some scenarios under this plan. Is that true?
Well, the fact is that, as the president said, nobody with a pre-existing condition or nobody should be priced out of the market if they get a bad diagnosis. And right now what we're seeing is significant challenges in those individuals who have pre-existing conditions. But again, they've got that card, but they can't get the care because their deductible is so doggone high. So what we want to do is create a system that's responsive to patients, that makes it so they can indeed get the care that they need and that they desire. And that's the goal. Now, again, as I said, change is tough. There's no doubt about it. But the fact of the matter is that the current system is failing those patients. And if we just continue down this road, we're going to have more and more upheaval within the market itself. And the voices out there that say, well, we can't continue down this road will get louder and louder and louder. And the doctors that are not able to participate in the system will get more and more. And that's the crisis that's actually occurring.
All right, Secretary Price, obviously a very complicated conversation. We hope you'll join us again to talk more about it as we continue down this path, but we appreciate your time today.
Look forward to it.
Yeah,
Thank you so much.
We may need you next week, Mr. Secretary. We'll see.
Good deal.
What's your phone number? Can you just give that? No, I'm kidding. But we may, you'll be hearing from us. We appreciate you coming on today, though.
Thanks so much. Have a great weekend.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.